40% of cancers don't present with very well-known symptoms and signs, so they're very non-specific. And I think GPs struggle with diagnosing those. I think secondary care physicians sometimes struggle with making a proper diagnosis, and it is sometimes quite difficult to put all the pieces together to come to a reason for why somebody doesn't feel as well, or perhaps isn't as well. And for that group of patients, there's often what we describe as a gut feeling that doctors will have about somebody who maybe they've known for some time, as GPs obviously, not being as well and not putting their finger on why that's the case. And it would be nice to think that there was perhaps a pathway for some of those patients, so that maybe if a GP is struggling with one of their own population, that they can recognise there's a problem, but they don't know what it is, can perhaps have a panel of tests and then meet with some secondary care diagnosticians, probably general medics, so maybe a consultant geriatrician, maybe an oncologist on the board, maybe somebody with some orthopaedic experience, because those are the sorts of things that might occur in the more elderly population, and obviously cancer affects more people over 70 than it does under 70. So I suspect some sort of board maybe within the community to discuss those gut feeling type patients may well expedite their passage through the right gateway into the right care at the hospital, and hopefully avert A&E admissions, etc. So I think the modelling would have to probably take what currently happens to those patients. So you would ask a group of GP surgeries to act as a pilot site, and you'd say that you probably have patients like this, and we would like to ask you what you do with them. And I suspect what happens is that they see the patient, identify a single test, bring the patient back, identify another test, and one by one they build up a picture. And I think what I would suggest is that if they've got that feeling, and maybe you give it a couple of weeks, it might have been some sort of viral illness and the patient recovers quite quickly, in which case clearly you don't need to take things further, but perhaps after 2 to 4 weeks the GP says, right, you're no better, let's institute full panel of blood tests, urine tests, CT scan, and let's bring you to our board of non-specific but serious symptoms and discuss what we do from that point. And I think then you might be able to follow what then happens at that board. Obviously you will have modelled your standard, what normally happens outside, and then you can actually see whether if you can model that patient into the secondary care setting and get the diagnosis, and when the patient becomes better, you should be able to find, hopefully, that you've expedited the treatment and management of that patient.